This videotape is designed to be used as an introduction to ice rescue. This videotape will cover some of the most effective procedures, as well as some insight and helpful hints that should make your rescue attempts more successful. Before implementing these procedures, it is advised to first apply them in a controlled atmosphere.
There you go, talk to him. Hold on a little bit longer.
Each year, thousands of people are victims of ice water accidents. If basic rules are heeded, however, many of these accidents can be prevented. The only absolute in ice safety is to stay off of it. Concerned with saving human life, however, you will probably disregard that absolute. Armed with a more complete knowledge of how ice is formed, the types of ice, and the affecting ice strength, you will be better equipped to judge the perils to yourself in any rescue situation. Remember the general rules. Thickness is only one of many determining factors in ice safety. The following guidelines indicate what kinds of activities clear, solid ice can support. 2 inches, walking. 4 inches, fishing. 5 inches, snowmobiles. 8 to 12 inches, vehicles. Warning, these are only guidelines, not guarantees. Many factors besides thickness affect ice safety. Weather, wind, snow, sun, temperature, etc. Ice near obstructions, slush or snow, bubbles or water on the ice surface, candling or a porous look, cracks in the ice, pressure ridges or faults, water running underneath the ice, pressure cracked shore ice, open water in the middle of a deep lake. One last note, the most dangerous aspect of ice is its unpredictability. In some instances, ice can measure 1 foot thick in a given area, while 10 feet away, it will measure 1 inch thick. Given these pitfalls, the rescue attempt must be of an extremely cautious manner. Therefore, the first rule of ice rescue is the ultimate safety of the rescuer must always come first. In other words, never let yourself become part of the problem.
Talk to me.
The first rescue procedure is personal self-rescue. Even though you're a trained professional, always be prepared to fall through the ice. There are certain precautions that you can take, such as utilizing a PFD or a safety harness and ropes. If caught without this equipment, there are still some steps you can take to ensure your safety. It is advisable to practice the following techniques in a controlled environment to ensure their effectiveness. If you feel yourself breaking through the ice, cover your face with your hands. This will prevent torso reflex, an involuntary reaction from a sudden shock of cold water. Anyone who's ever stepped into a cold shower knows the effects of this reflex. If your mouth is underwater when this gasp occurs, drowning is the most probable outcome. If submerged in full turnout gear, do not panic. There are certain basic methods of helping yourself out of the water. One such method is the use of hand picks, a very inexpensive but effective tool for helping you up on the ice. These hand picks are used as solid handholds, allowing you to dig into the ice. These hand picks may be purchased or made by using sharpened screwdrivers or wood blocks with double sharpened nails hammered into the end. These are then joined together with a thin rope. Without hand picks, the method that should be attempted to climb onto the ice is to fold your arms onto the ice and kick with your feet. Always attempt to leave the ice where you originally fell through. If the ice was strong enough for you to get to that point, it should be strong enough for you to get back. If you cannot get out of the water, don't panic. Buoyancy can be obtained in 3 different ways. Number 1, immediately after submersion, remove your helmet and trap an air pocket in it while pulling your helmet towards your stomach. Number 2, while submerged in water, relax into a heat escape lessening position, also known as the help position. Cross your ankles, cross your arms over your chest, draw your knees to your chest, and lean back and allow your boots to rest on the surface of the water. The air that is trapped in your boots can keep you afloat for hours. Number 3, the suit itself will support you. The air pockets in the clothing will be sufficient to support you for a limited time. To reduce air loss, try to pinch the collar of the coat closed. It is highly critical that you've mastered these steps, because the first option you have in rescuing someone else is taking them through self-rescue. You and your team are expected to think logically and quickly in any emergency situation. Each of the rescuers knows his or her responsibilities prior to reaching the rescue site. The success of any rescue attempt depends on teamwork. The ideal ice rescue team consists of 7 members. The most important role is that of the commander. It is the responsibility of the commander to observe, evaluate, and direct the team. The first decision of the commander is to weigh the risk versus the benefit. Condensed, this means, is the rescue of one person worth the lives of multiple rescuers? It is an important point. Though a harsh statement, it is a reality that must be given careful consideration. This is one reason why the commander must never ideally be involved in the rescue attempt. They must be able to view the entire site so they can direct the rescue attempt with full knowledge of what every member of the team is doing. The remaining 6 members are broken into 2 teams, each containing a land-based backup, and a rescuer. Team 1 will attempt the rescue. If unable to perform the mission, Team 2 will be ready to assist. The backups will make the first contact with the victim. Upon arrival at the scene, the backup should take basic rescue equipment, such as lines, throw bags, and flotation devices, and make contact with the victim. For the victim, the verbal encouragement from rescuers may make the difference between the victim fighting for survival and just giving up. The land-based backup is located on the shore or working lines. The rescuer makes actual contact with the victim. The secondary rescuer serves as a backup to the primary rescuer. They concentrate on the victim's condition and safest approach and exit. The rescuer's own safety must at times be placed in the hands of the backups. The number of rescuers needed to perform a given rescue will depend on several factors. Crowd control can be a very important job and may ultimately prevent other tragedies. Once the decision has been made to perform a rescue attempt, it must be determined which type of rescue will be the most efficient method of bringing the victim to safety. The condition of the victim is a critical factor in determining which type of rescue to attempt. Most fatalities in cold water are not the result of drowning. They are victims of hypothermia. Exposure to cold water and cold air can cause hypothermia in any person who is unprepared. Hypothermia refers to the lowering of the body's core temperature below the normal 98.6 oral temperature. The loss of body heat can occur 25 times faster in cold water than in cold air. In the first stage of hypothermia, the victim will still be alert. They will experience shivering. They will have cold hands and feet, and they will be able to help in the rescue attempt. In the second stage, they will experience pain or numbness in limbs, and they will experience loss of dexterity and clumsiness. In the third stage, shivering may decrease or stop. In the fourth stage, loss of reasoning begins, confusion, abnormal behavior. Victims may appear drunk, very clumsy. They will slur speech. They may deny the problem and may resist help. In the fifth and sixth stages, the victim will become semi-conscious to unconscious, and muscular rigidity increases. It is important to watch for these stages, not only in the victim, but in the rescue team as well.
Hey buddy, what's your name? Can you hear me?
It is important to establish and maintain contact with the conscious victim. It is a must. At this stage, they may be capable of self-rescue. Verbally instruct and reassure the victim to self-rescue. Slide picks to the victim. Instruct them to use their arms to get out and to kick their feet. If they're unable to pull themselves onto the ice, you should be ready with one of 3 basic methods of the ice rescue: reach, throw, or go. The reach method. In this method, a variety of tools may be used to pull the victim to safety. This requires a rescuer and a land-based backup. This rescue attempt may require you to go onto the ice. Don't let yourself become part of the problem. Wear a PFD, safety harness, and rope, and have an adequate backup. In this procedure, maneuver yourself within reach of the victim. Be sure to move cautiously across the ice. Crawl. As you near the victim, lie on the ice. Then use what you can to reach the victim: a ladder from the truck, a fire hose inflated with air, a PFD, a pike pole or branch, jumper cables, a child's sled, your hand. The victim may experience shivering and loss of dexterity in their hands and feet, which can make it difficult for them to grasp the equipment. So if they can wrap their arms around an object or put their hand through a loop, there will be a greater chance of success the first time. There may be times that the victim may be farther out than practical for reach methods, or that a reach method may not be quick enough. This is when the throw method should be used. In the throw method, the rescuer uses 50 to 70 feet of rope attached to anything that will keep the victim afloat. This may be a specially designed water rescue bag, a life jacket attached to a rope, or a specially adapted Hylex bottle that should be a part of one's standard rescue gear. It's easy to make and inexpensive. The rescuer should grasp the free end of the rope with the non-throwing hand and release the object with an underhand throw. Once the object reaches the victim, they should wrap the rope around themselves before an attempt is made to pull them out of the water. The last method is the go method. In the go method, the rescuer must be prepared to enter the water. This may mean by boat or rubber raft, specially designed ice rescue sleds, or wearing a specially designed survival suit or other protective wear. There should be a backup on shore and a safety line on the rescuer. The go method may be used when confronted with open water between the victim and the rescue team, or when a victim has entered the later stages of hypothermia. When attempting a go, never run on the ice. Use a shuffle-type step if the ice feels secure. Crawl when the ice conditions become less secure. If there is more than one rescuer in the water, it is important that safety lines be kept clear of one another. Because victims and rescuers may be out of hearing range or conditions do not permit audible signals, it is important that a series of hand signals be developed by the team. If the victim is conscious, they should be encouraged to move around. If shivering is not yet pronounced, wrap the victim in a warmed sleeping bag or under several blankets. Try to keep the victim awake and talking. Some slight elevation of the legs and feet is desirable. Special precautions should be taken if the victim is unconscious. Number 1, begin CPR. Number 2, prevent the victim from losing more heat, but do not rewarm the victim of acute submersion hypothermia. New evidence has shown that ice water refrigerates vital tissue, sometimes preserving it for 45 minutes or more after breathing stops. New medical treatment allows time for the emergency personnel to remove the excess water from the victim's system before the brain begins to warm up, thus preventing mental damage. Number 3, get the victim to the nearest medical facility quickly. Number 4, do not give up. Cold water victims look dead. Their skin is blue and cold to the touch. However, if the water was cold, there is still a good chance of survival. To review the steps of the rescue approach: number 1, establish communication with the victim. Number 2, establish a command post. Number 3, select the rescue approach. Number 4, station backups. Number 5, attach safety lines. Number 6, extricate the victim using self-rescue, reach, throw, or go. Number 7, bring the victim to shore. Number 8, administer emergency medical treatment. Number 9, secure the rescue scene. With practice and your ability to think quickly and logically and act with a team consciousness, the success of your rescue attempts will greatly increase.